By the end of this PowerPoint, you should be able to identify etiology and risk factors of Ramsay-Hunt syndrome, as well as signs and symptoms, the prognosis, the treatment, medical treatment, as well as the PT's role in treating Ramsay-Hunt syndrome.
Alright, so to begin with, this disease is also called varicella herpes zoster. What that is, it's caused by chickenpox that we get as a kid. So the main mechanism of this disease is that the virus that we get from the chickenpox remains unactivated either in the dorsal root or in the axons of the cranial nerve. So this can happen if one of these get activated again, the virus in these areas, or if you get the virus when you're not at a pediatric age. So here I'm going to be showing you the signs and symptoms of Ramsay-Hunt syndrome. So to begin with, there are three major things to look at, and here's a photo. So the first one is looking for that rash on that ear. It's only going to be on one side since the syndrome only affects one side of the face. The second one is looking at that lower neuron paralysis of the facial nerve. So one side of the nerve is going to be drooping. And the third one's going to be that loss of taste sensation over the anterior 2/3 of the tongue. So you got 1, 2, 3 main signs and symptoms right here that's going to say, this person might have Ramsay-Hunt syndrome. So now I'm going to show you some real life examples. As you can see, she has the rash right here, and she has the rash as well over here. As you can see on this side, her face is drooping, her eyelid is closed, and it's going to be the same on this side. Okay, so more signs and symptoms. Your patient might complain of ear pain, hearing loss, ringing in the ears, especially that one side right there, difficulty closing one eye, sensation of spinning or moving, which is vertigo, and a taste and change perception or loss of taste. So adding on, there is a 50% chance of complete recovery from this syndrome. And it's better if it's younger because it just works that way. And so there's a poor prognosis if the individual is older than 50, complete facial paralysis, or lack of cranial nerve 7 nerve excitability. So we're going to show you a video. She's different from the typical Ramsay-Hunt syndrome patient since she is young. However, her story is a pretty good example of what the patients have to go through and kind of what they struggle with when they have this disease. So here she is.
When I saw the neurologist, I explained my symptoms, which not only included the facial paralysis, but I noticed that my balance and coordination on my left side was now impaired. The neurologist then decided that it was possible that I had Ramsay-Hunt syndrome. The following day, I started to get really terrible earaches, so I went back to see the neurologist, and then I was diagnosed with Ramsay-Hunt syndrome. They gave me some steroids and some antiviral medication, and then a patch which I put over my eye, and then I put my eye mask over the top of it to sleep because I've lost the ability to blink and close this eye, so the eye gets really dry.
So the main treatments for chickenpox include antiviral medications and corticosteroids. These first two actually treat the effects of the chickenpox and help to combat it. The antiviral medication actually combats it, and the corticosteroids helps to boost the antiviral medication. The anti-anxiety medications are used to treat the symptoms of vertigo that most people experience, and pain relievers are used to treat the pain that a lot of people have because herpes zoster is very painful. Shingles is very painful. What is the evidence for physical therapy for Ramsay-Hunt syndrome? Well, the two main reasons that you might treat Ramsay-Hunt are for facial weakness and for the vestibular deficits. For the facial weakness, we found that there are many facial exercises that can be done, as well as electromyography, which was found to be effective at treating it and improving the facial muscles' function. And for the vestibular deficits, there are many postural control exercises that are found to be effective, although the evidence for the postural control and for the vestibular imbalances was not quite as strong as for the facial muscles.
Okay, so here is our Icf model, and we're going to see how Ramsay-Hunt syndrome affects the body structure and function, activity, participation, environmental factors, and how personal factors are all combined together for this condition. So the first one we're going to be looking at is body structure and function.
For people who are diagnosed with Ramsay-Hunt syndrome, there are many impairments that are affected, including strength, motor control, hearing, taste, pain. There's also a skin rash that's involved. For strength, the strength on one side of the face decreases. The motor control also decreases. This is for balance and coordination. The hearing on that same side as the muscles on the face, that also decreases. So it's all one side. The taste and the tongue decreases as well. The pain increases a lot for many people. There's also a skin rash that's oftentimes around the same ear as the hearing.
So after going through body structure and function, we're going to look at activity now. So for activity, it's going to be divided into two parts. There's abilities and limitations. So for those who are diagnosed with Ramsay-Hunt syndrome, there are some abilities that they are able to do. One of them is that they are able to speak, and they are also able to walk as well, since the facial nerve does not innervate the lower extremity. The other one is that they are able to swallow as well. They're also able to do things on their unaffected side, so closing their eyelid, using those facial muscles, and hearing. So unfortunately, there are also limitations for those who have Ramsay-Hunt syndrome. One of them is being able to smile, since you need both sides of the muscles to really smile. The other one is closing the eyelid, as we showed in the video beforehand. Taste is affected as well, and they are not able to hear from the affected side, so they're going to have some hearing impairments going on in there. Next in our model, we're going to talk about participation.
So for participation for Ramsay-Hunt, they're both abilities and restrictions. For abilities, the people are still able to ingest food as well as walk their dog. They are still able to drive as well as perform any recreational activities. These can include watching a movie or having fun with friends, and they're also able to clean around their house. For some restrictions that they have, they might find it embarrassing to eat in public because oftentimes there's poor oral control, so that the food might slip out the side of their mouth. They may avoid eye contact in public because they don't want to show people their scowling face if someone smiles at them. Then they can't reciprocate, so it might be a little embarrassing for them. They also cannot smile for photos, and they also may have some difficulty falling asleep because they cannot close one eye.
Now for the remaining two, we're going to talk about environmental factors first before we talk about personal factors. So for environment, we decided to make a 2x2 box, not the 2x2 box, but just as important. So we have external, internal, positive, and negative. So what we're going to talk about first is the external positive, which is going to include family, friends, and health staff. All three of those can create a positive impact on the individual and really change how they look at their condition, how they perceive things that are going on. And then for positive internal, the individual can have hope and motivation, especially if they're on the younger side. They have a better prognosis, so they're going to be motivated to do their exercises, and they're going to have the patience to wait as well. So unfortunately with the positives, there's also going to be negatives. So external environment, what they may not like is being stared at because of their face might be drooping. They might get stares from strangers, friends, and even family. The other one is getting stressed from the family as well. What we mean by that is that the individual knows that their family is worried about them, so they get stressed because they know that their family is being worried about them. And then last one we put down is being support from a third party. Insurance is probably not going to help this. It may not. It really depends on the plans, and especially with the medicines that are involved, it could really take an effect on an individual. And then last we have for negative internal, these are mostly worries, so the individual could feel embarrassed about how they look because it's going to be something visual that's going on in there. They could be worried about the condition, like, am I going to get better? They're also probably worried about not being able to smile when someone smiles back to them, and they're probably going to be worried about being stared at because of how their face looks.
So for implications, there's implications on how other health professionals can help people with Ramsay Hunt. The medical doctors, for example, can help by diagnosing the patient correctly, because early diagnosis and early treatment with the antiviral medication and the corticosteroids can help to decrease the symptoms and help them on their way to treatment. So a really good doctor who makes sure to the patient's really well informed and make sure that they get the medication and why it's important, and gives an education why to take it is very important. And they should also refer the patient to physical therapy if there are any symptoms of the vestibular deficits or the facial weakness. And the PT's role is if we see anybody, if the physical therapist sees anybody with the signs and symptoms of Ramsay Hunt, that we should immediately refer them to the medical doctor or the neurologist. And we should also help and treat the patients who have the vestibular deficits as well as the facial weakness. In addition, our role is to treat and educate the family and caregivers as well as the patient, and to give the patient support. Over here we have the family and caregivers, and they are giving 24/7 support to the patient if they need it, as well as providing them many other services that could, calling them frequently, helping to prepare their meals, especially if there's more lethargy, all sorts of other things too. Thanks. So now we're going to go through some questions to check your understanding for the presentation. So the first one is, how was the woman's in the video's presentation different than the classical presentation of Ramsay Hunt? Take a second to answer. You can pause the video if you need to. And the first three and last one were all changes that are different, that she had that was different than the classical presentation. So she was younger, she did not have the rash over her ear, she did not have any deafness or any auditory changes, but she did have the facial paralysis, which lines up with the classical presentation. The next question is, which one medication is the best for treating Ramsay Hunt? Take a second to pause the video. And the answer is the antiviral medication. The corticosteroid is not one because it acts as a booster and will only help to make the antiviral medication more effective. It won't do any treating on its own. And which of the indicators are ones for worse prognosis? Can take a moment to pause the video. And the answers are the first three: age, full facial paralysis, and a non-responsive cranial nerve 7. Those are all indicators for a worse prognosis. So if you're older, there's no activation on your facial muscles, and your cranial nerve 7 does not respond, and you have a worse prognosis. Gender is not one. Which childhood illness does an individual need to contract to get this condition? Take a moment to pause the video. And the answer is chickenpox. What is the physical therapist's role for treating someone with Ramsay Hunt syndrome? Take a second to pause the video. And the answer is all of the above, except for diagnosing the condition and going to the patient. Diagnosing a condition is a role for the doctor to have, and no healthcare professional should ignore the patient because that's not good practice. But we are responsible for referring patients that present with these symptoms, as well as treating impairments and giving patient education and support. Thanks for watching, and these were our sources.